All right, so
Good afternoon.
one more session, and I'm glad to see you today. And what's the topic?
My pleasure to see you. We talk about various supplements, and I think one of the topics that we discussed before, and people asking all the time, why do you sell in your office? Not regular, not just writing regular prescription or doing regular tests, that you're very good at diagnostics, etc. But like, why you also selling like some pills, but not the regular pills, but like some supplements, like specifically zinc. And it was the first time in my experience I saw anybody in any medical office not just prescribing zinc, but even having actual like bottle like zinc mega, like, so why it's so important to like that you selling it in your office?
It's a good question, and I'm glad you raised it up. And the reason for that is because zinc is an extremely important part of our body. And every dietitian knows that if you want to heal something, you need three things: protein, vitamin C, and zinc. Why is that? That's because zinc is the part of about 300 enzymes. And without zinc, you can't actually achieve anything in your body, including the neurotransmission or hormone synthesis or repair. That's the most important thing, and that's why zinc is very commonly used for treating something when you need some kind of repair.
You're talking about wounds? You're talking about someone who got into
wounds for sure. Wounds for sure. Wounds for sure. And as I said, that when somebody has a chronic wound that doesn't want to heal, then what we do, we call dietitian, and dietitian saying, hi guys, this person needs protein, zinc, and vitamin C. Why is that? That's because zinc and vitamin C and proteins, they are required to make collagen. And collagen is the one of the most important proteins to heal, because that's basically what the scar is. When you have a cut, that you need some kind of repair mechanism, some kind of protein that just heals the wound that you have.
Again, we're talking about like person who is working as a cook, person who is a fisherman, person who just made the cut, anybody?
Not necessarily. And when I'm saying that it's necessary to repair something, it's even a common cold, and that's why a lot of...
Common cold?
Common cold, yeah, you need to heal, right?
But I never heard that someone prescribed zinc when you have a common cold.
A lot of zinc syrups, a lot of syrups for common colds, they contain zinc.
Okay.
Then contain zinc, and that's, zinc supports healing, and that's what we use. And a lot of people who comes to me with skin condition, they might need zinc and to support their healing, and that's why a lot of patients who come and or eczema supposedly, or some kind of other skin disorder, and I recommend zinc to support the healing process.
So you're saying if anybody coming even to a regular dermatology problem can also use it and successfully?
Well, not necessarily. Depends on what kind of problem this person has. Who has...
Just mention eczema, for example.
Yeah,
very
eczema,
common.
Yeah, like eczema is... first of all, when somebody has an eczema, first thing I recommend is to wear gloves. That's first thing. Yeah, that's very common thing. See, what we are trying to do is to use simple things. We are trying not to make it that complicated. And who comes to me with eczema, the first thing I tell that are you wearing gloves? And sometimes gloves can solve all the problem, and zinc also can support. I don't need to explain you why gloves are so important, right?
Of course.
Yes, because that's it just prevents the chemical to get to the skin and create an inflammation. So that's very important. The first thing.
One of the reasons why so many patients and people, including myself, respect you is because you often suggest simple solutions to complicated problems that people never heard of or like never even thought about it, like you just mentioned.
Well, I agree.
It's a simple, but like some people like just like don't even think about it.
Yeah, it is. Let me give you another
like zinc to give zinc.
Another example. Just who comes to me with erectile dysfunction, supposedly?
Men, of course.
Men, I understand. But
And like older men, like after 50.
yeah, just what I'm saying is that I often suggest to support the treatment of erectile dysfunction zinc. And here is why. Because, you know, in
So
order...
you're saying it helps? Now
I'm
you
saying-
have a line
I'm
of
saying-
people outside the requesting
I'm
this.
saying that supports the treatment of erectile dysfunction. And here is why. Listen, supposedly somebody has a hormone deficiency, testosterone for example,
Testosterone, okay.
or thyroid hormone. Somehow, not everybody asks himself or herself a question, but do I have enough nutrients to produce this hormone? Somehow people start to replace testosterone or thyroid hormone, for example, and they never ask themselves that question. Maybe you don't have the enough nutrients to produce it. Maybe you just need to take simple nutrient and everything will be fine. I'm just serious. Supposedly somebody has a thyroid hormone deficiency, but for thyroid you need what? Iodine, right?
So you're saying that just by taking more zinc, men will increase, it will be more testosterone in the man's organ. Is that what you said?
That's what I'm saying, that zinc supports testosterone production. And this is a very well-known scientific fact, because in order to produce testosterone you need zinc. You can't produce testosterone from nothing. You just can't do that.
Do you have zinc in can we find zinc in any food, like, I don't know, vegetables or, I don't know, meat?
It's
You
not
know
that.
better.
No, it's not that. It's not about food. It's a very interesting question. I'm glad you asked that. Do you know what actually we need to produce testosterone besides the main thing, besides zinc? Guess what? You need number one killer in the United States. It's called cholesterol.
To produce testosterone, you need the cholesterol?
Of course.
But everywhere, everybody trying to lower the cholesterol. That's
Well,
everywhere.
lowers his testosterone, his cholesterol at the same time.
Everybody wants to lower, or
lowers-
zero, no cholesterol.
lowers his-
Everybody will go and on
lowers-
shelves and looking
yeah.
for zero cholesterol.
Yeah,
And
lower-
you saying it could be cut both ways.
No, first of all, in my understanding, actually not in my understanding, cutting down testosterone in food doesn't make that much sense. And the reason for that is because 2/3 of cholesterol is not from food, it's produced in your own body. So it doesn't really matter how much you eat. I mean, it does, you know, but...
I know it's not the topic of our session today, zinc we're talking about, but is it true if it's that stress creates cholesterol? That if person under stress sometimes cholesterol goes up, is it true?
I can't tell you exactly, but what I can tell you is this, that stress hormone cortisol is made from cholesterol as well.
So there is something.
So that's what I see in my practice, yes. Who has chronic inflammation or something like that, usually their cholesterol goes up, and the reason is obvious, because they need steroid hormones that is necessary to suppress inflammation. And guess what happens to testosterone? It goes down. It's called cortisol steal, because all the cholesterol is switched to the production of anti-inflammatory hormone cortisol instead of making testosterone. So who wants to be more sexually active should think first about how much inflammation they have in their body. And the most logical step is to reduce inflammation, then they can make their own testosterone.
How to reduce inflammation?
Well, that's a very big topic. So I would first we need to localize it. But in order to support what I'm telling you, is I will give
Physical
you a
exercise?
case, and I will just tell you a case that happened in my practice.
Oh, okay.
And the guy came to me complaining of erectile dysfunction, said that he is not as good as he was when he was 18-year-old, and we just did the blood test, and we found out that his cholesterol, that his testosterone was borderline. But at the same time, I noticed that his cholesterol was also on the low side. And I told him and asked him why, and he said that the doctor prescribed him some cholesterol lowering pills and to bring his cholesterol down. And recently the doctor increased the pill because he's not happy with the cholesterol. And I said, well, you can bring your cholesterol further down, but what will happen is that your testosterone will go down too.
Something else will go down too.
Yeah, that's for sure, and that's what happened. The guy didn't listen to what I was saying, and he increased the dose of statin. His cholesterol went down, but his testosterone plummeted. You know, it went down.
And then did you talk to him again?
Yes, I did.
Did he listen
And I did.
finally?
You know, he is kind of his profession. You know, is that he is in the field who doesn't listen to doctors. You know, so I don't think he did. But I spoke to him a couple of months
Will it
later.
help him, Zinc?
I'm telling him he didn't follow my advice.
Yeah.
Yeah, he didn't follow my
That's
advice.
bad.
He didn't
That's
say
bad.
no. He had his own opinion. He got the result. His testosterone. First, when I spoke to him about 2 months later, he said that his erectile dysfunction transformed into almost full impotence.
Oh,
Yeah, and I said why, and he said that we figured it out because my cholesterol went down because of the statins. I said, I told you.
I told you so.
Yeah, and but that's the way it is. You know, see, you can't change this kind of important stuff like cholesterol, and without changing other stuff. And nowadays, even cardiologist says that coronary artery disease doesn't have that much to do with cholesterol. It has to do with inflammation, and that's what we are talking about for a long time.
But do you have anybody who started, any patients who started to take zinc and
Listen, personally, I'm taking
their health
zinc.
conditions strongly improved?
I am taking zinc.
Oh, okay.
Well, I'm very happy.
So
with
then
that, yeah. And but you know, you need
You
to
do
keep
what
in
you
mind.
preach. How do you say?
Yeah.
You say what you
Yeah,
preach.
I
You do what you
religiously take zinc. I religiously take a few supplements like vitamin D with K1. I take zinc. I copper. I take copper. That I take magnesium and selenium, iodine. That's the basic stuff. Vitamin C. That's the basic stuff I'm taking. But what important thing is here is two things. First, taking zinc without having a healthy digestive system doesn't make any sense. It's not going to be absorbed. So, in order to help with that, and also you need coenzymes. So, what we did actually, we have chosen to include vitamin B1, B6, zinc, and molybdenum in the same pill as well as taurine and malic acid. Why is that? Because zinc doesn't work alone.
Yeah. Okay.
Like, I don't know what your opinion is, but you can't do big things alone. So you need some help, and that's why it's very important to combine it with it.
What is it, vegetarian capsule? Why it's vegetarian?
Oh, it's a very important thing. I usually don't recommend.
Only for vegetarians?
No, that's nothing to do with that. See, regular supplements, they are made, the pills, they have to make it from something. And usually
Yes.
it's a magnesium
Pill
stearate.
itself, yeah.
Pill itself.
Okay.
Pill itself, and usually they make it from magnesium stearate. It's
Okay.
considered to be as an innocent product and doesn't make that much difference, but in fact, it works like a dirt in the digestive system. And what happens is it creates a microfilm on the gut, and it creates a lot of problem. It can actually do more harm than good. Because microfilm is not what you want to have.
So that's why this pill is like
Vegetarian,
unique.
yeah, vegetarian.
So
That
it
means-
also dissolves
it means
easily.
that- yeah, right, exactly.
Uh-huh.
And so in order to get zinc in your system, you need first of all the cofactors like vitamin B1, B6, molybdenum, but also what you need to have is healthy digestive system, obviously hydrochloric acid. Without hydrochloric acid, you just can't digest any metals, and that's very important. And another caveat here is that usually I recommend to take zinc with copper. Why is that? The reason for that is because zinc and copper, they use the same transporter. So if you take zinc only, the transporter is going to be occupied fully and no copper will be absorbed. But copper is extremely important in order to maintain our central nervous system, veins, etc., etc. So when you are lacking copper because you are taking zinc, you can run into very big trouble. There was actually an article in New England Journal of Medicine quite recently when the guy came to the hospital with neuropathy.
Okay.
And nobody could figure it out until they learned that the guy was taking zinc for a very long time without combining it with copper. So the guy had neuropathy secondary to a copper deficit. And the solution was very simple, just he was given copper and his neuropathy went
He
down.
recovered everything, okay.
So that's pretty much it. And for testosterone,
You
yes.
still did not answer my question about
Which one?
food. So there is no zinc in any regular food we eat?
No, I'm not saying that. What I'm saying is that zinc mostly is in meats, in fish, in poultry, fowl, and in...
So we do eat this food, then it's not enough. You mean it's not enough zinc there, correct?
It's not about that. Let me finish. It's also seeds and nuts. Seeds and nuts. And you know that nuts are especially, everybody knows nowadays that nuts is very important.
Okay.
So, but the problem is that the soil exhaustion. So when you eat a nut, it doesn't mean that you will get enough zinc because according to some specialists, we are getting 7 to 10 times less nutrients that we are supposed to. Yeah, because of the soil exhaustion, you know. The soil has limited resources. You know,
How about fish you mentioned and meat?
Fish and meat as well, but once again, the same thing. If you eat a beef that was fed with corn, what do you think will happen?
Same story.
Yeah, the same story. So it's not garbage in, garbage out, you know, that's they say. So the same thing is here. If this,
How much do you recommend it? Like 2 pills a day, 1 bottle a month? How does it work?
you know, that the easiest way to do is to take it once a day, usually covers all the needs. Sometimes who has erectile dysfunction or low testosterone, I usually recommend about 2 pills. So basically, zinc in this pill is 30 milligrams. So I recommend up to 60. And also I recommend that in order to get proper ratio between zinc and copper, I recommend usually for 60 milligrams of zinc, I recommend 2.5 milligrams of copper. That's the equation, that's the
How
ratio.
did you come up with these proportions? Why exactly these proportions?
That's not, this proportion is pretty easy, because this is just average doses of vitamins. Proportion about the zinc and copper, that's not mine. That's what they recommend. I don't know exactly how they figure it out, but that's the recommended proportion for
Who they?
60
FDA, Journal of Medicine, Board of Doctors?
No. I don't think that it's that simple. Basically, who is working with this,
Yeah.
that's basically recommended this proportion. I don't exactly can pinpoint it, but what I know is this. If you don't follow it, you will run into trouble like the patient I mentioned.
Good.
And even in the New England Journal of Medicine, the article, even though they acknowledge that the importance of combining zinc and copper, they never came up with any proportion. And maybe some doctors recommend, 60 milligrams of copper with 10 milligrams of copper. 60 milligrams of zinc with 10 milligrams of copper. I don't think that's that important, because your body knows exactly how much, but the point is that you can't take it alone.
So I wanted to know also, you gave 2 negative examples of patients. One positive is yourself.
Oh, I myself, yeah.
Yeah, but could you give another example of a patient who came to you, started to take it and significantly improved either his skin condition or erectile dysfunction condition, etc.?
No, erectile dysfunction, it's pretty common, and there's plenty of guys, but...
I'm not asking social security number, but
No,
example
no.
of a patient.
No, the patients usually, it's very hard to prove it, and the reason for that is because usually a lot of people, they can say this is a placebo effect. Placebo effect. But they really don't care. As soon as patient feels better,
They
I don't
really
care
see-
what it is. I don't care what it is. is zinc. My personal opinion is that zinc supports testosterone production. That's undeniable. I don't think anybody will deny it.
So when did you start to recommend patients?
Or for a long time.
So not like
For a long time, no.
several
It's
years
like
ago?
at least 5, 6,
Wow.
maybe 10 years. Yeah, it's for a long time ago. Because that's the first thing. That's the same thing. When somebody comes with low thyroid, the first thing I recommend is iodine. It's a common sense. You know, like, let me ask you this. When you go to the store, right, and you expect yourself to put some, to pay some money for it, like some cash, don't you think that you need to put the money in your pocket first before going to the store? And you don't need any recommendation from New England Journal of Medicine for FDA for a so simple thing.
Of course.
You don't need to ask a government, do I have to put money in my pocket before going to the store and buy some groceries?
Obviously.
No. The same thing is here. Why don't you just stick to the common sense that if you need some testosterone that needs zinc for its synthesis, why don't I take zinc first?
Okay, so it looks like we're talking about a lot of happy patients, both men and women. And women also, because you said it helps with cuts, so
it's not with scars, it's with skin conditions. I'm not saying that it helps.
It's advanced.
I am saying that it supports healing, because the products that help it can be only FDA approved. What is not FDA approved, it supports. That's why I never
You're
say
very
help.
careful, I know.
Yeah, it
You're
supports.
very
It
careful.
supports. Because whatever helps or alleviates, it has to be FDA approved. This is support only. All right, so that's pretty much it. Any other questions?
No, you said like food is good, but it's not replace supplement. That's why it's called supplement.
I mean, yeah, it needs to be, you know, because of the soil exhaustion. It's a common sense to supplement to get some support.
So you got it. Without zinc from Dr. Kalitenko, you cannot increase your testosterone.
I didn't
You
say
cannot.
that. You need support.
I'm saying this. You know, you're not saying this. And also, if you have any issues with your skin issues, it helps you tremendously. So it's important. It's not just one of the elements.
It supports.
It supports you. You know, like this one supports you, and we support your efforts to support your patients. Okay.
Yeah, to support.
Okay.
Good.
Thank
you very much.
Thank
It
you.
was a pleasure.
I appreciate it.
As usual. And see you next time then.
Absolutely.
Okay. Take care. Bye.